Hi, I'm Dr. Bennett Brown, a hand and upper extremity specialist with the Orlin Cohen Orthopedic Group. Today I'll be talking about carpal tunnel syndrome. Carpal tunnel syndrome is a very common problem that affects the hand and fingers, most commonly the thumb, index, middle, and half of the ring finger. This condition has recently gained a lot of attention because of suggestions that it may be associated with occupations that require repetitive use of the hands and fingers, such as typing. However, anyone can develop carpal tunnel syndrome. To review some background information on this condition, the carpal tunnel is a space or tunnel located at the wrist that contains 9 tendons and the median nerve. This tunnel and the 10 components that pass through it are surrounded by very unforgiving structures, some wrist bones, and a thick ligament. When the space in the tunnel gets smaller, for example, when tendons increase in size, as with repetitive or overuse of the fingers, such as typists, increased fluid is present, as with pregnancy, or when the ligament becomes thickened, as with people who place a lot of pressure on their hands or use vibrating tools, the nerve gets compressed and damaged. Symptoms that patients experience when this occurs can vary. Early symptoms can include some numbness or tingling in the fingers. Pain can also occur and frequently wakes people up at night. Weakness in the hand and fingers is a late symptom of median nerve compression. I prefer to treat carpal tunnel syndrome with conservative or non-surgical measures first. A wrist brace can be used to relieve pressure on the nerve. Although it may be cumbersome for some people to wear during the day, it can be very effective at resolving night pain. Over-the-counter anti-inflammatory medications can decrease swelling and inflammation at the carpal tunnel, which can relieve some early symptoms in this condition. If bracing and anti-inflammatory medications do not help, a cortisone injection can sometimes alleviate the patient's symptoms. Cortisone is a strong anti-inflammatory that can decrease swelling in the carpal tunnel and thus relieve pressure on the nerve. The last line of treatment is a carpal tunnel release. This small surgery is an outpatient procedure. The surgical incision is small, about 1 inch long. The ligament over the carpal tunnel is released, which gives the median nerve room to breathe. The entire procedure usually takes about 5 to 10 minutes to complete. After surgery, patients are placed in a soft dressing with their thumb and fingers free. Once the incision is healed, generally within 10 days, the patient can return to most of their daily activities. Most patients require some form of therapy after surgery. This therapy might include range of motion exercises and strengthening of the hand and fingers. The pain, numbness, and tingling are usually alleviated immediately, and then strength improves gradually. For more information on carpal tunnel syndrome, you can visit the patient education section on our website, orlincohen.com. To make an appointment with me or any of our other subspecialists, please call our office or visit us online.